guys, it's Addison Ritchie, one of the nurse practitioners at Live Oak Testosterone. We wanted to kind of address lots of questions that we're getting in the skincare aesthetic world on how to address everything from fine lines, wrinkles, pigment, acne, and just aging. And on a grander scale, the answer is going to be procedures. So chemical peels, microneedling, and even lasers in some situations if it's available. Obviously, on a milder scale, skincare, prescriptions, things like that are going to be really helpful. But we want to address today the procedures. So chemical peel is one of my favorite to be aggressive with not a ton of downtime, but also hardcore results. So chemical peel, the one we specifically offer, is the 3-step peel by ZO. It has 3 different acids: TCA, salicylic acid, and lactic acid. And the combination of those 3 acids on a very simplistic platform are going to help kind of slough off the first couple layers of skin. And in that process, it's going to enhance or sort of trigger your body to create another layer, and in turn increasing the production of hyaluronic acid, elastin, collagen, all of the things. More specifically, it can target pigment, great. It can target acne scarring because it's gonna penetrate deeper layers of the skin than what just topical medications are capable of. But it needs to be done in the right place by the right person, and you've got to be prepped for this. So this is one of the peels that is more aggressive, so you have to be pre-treated. And by that, we mean you've got to be doing a 0.05 tretinoin or retinoid of some form consistently every night for at least 4 to 6 weeks until you've stopped that peeling, itchy red phase. If you're not doing that, we have to get that started and get that going in order to qualify for this sort of peel. Much more mild peels that are offered, you don't need to necessarily pre-treat for, but this one is gonna penetrate deeper to where we have to get your skin prepped and ready, meaning it's gotta be thinned and it's gotta be conditioned. Once you're conditioned, we get you scheduled. We specifically like to sell them in a package of 3. Dr. Obagi says if 3 chemical peels a year stops your aging in progress. So we specifically like to advertise it that way because it's optimal. You know, you could get 1 a month, every month, the rest of your life if you want, that would be great, but pricey. It's going to have more benefits. So we would say at least 3. So you can do 3 consecutive months. You can spread them out yearly. So how it's gonna work, obviously the first part is gonna need to be pre-treated. If you're pre-treated, then we get you scheduled. The process is what we call a little spicy, meaning if you've ever had anything cosmetic, there are times where it's gonna sting or burn a little bit, but we have a handy dandy fan that kind of helps calm things down. So how it works is we clean you off. We take some great pictures, obviously, beforehand, because that's gonna help us really see the before and afters. And then we clean you off, we lay you flat, and then we give you the fan, and we literally just, the peel solution is on a little cotton swab. And I again like to always address face, neck, and chest, because why make your face look like it's 30 while your chest looks like it's 60? It's just gonna give you away. So we like to address all areas, especially that are affected. So we kind of paint on the chemical peel. At that point, you start to feel anything from mild to severe stinging or kind of burning, but the fan that you're able to kind of move around kind of really calms that down. So that lasts maybe 2 or 3 minutes until we're done with the layers of the peel. Once we have all of the chemical peel solution on, we put a little packet of retinol cream. This is a complex retinol cream provided by ZO that comes in the kit, and it is going to sort of just like cherry on top exacerbate your results in efficacy. Once that cream goes on, it kind of puts the fire out, so that feeling that you have of that stinging and burning kind of goes away. And then we put a great creamy hydrating cream on, which kind of soothes your skin and kind of calms it a little bit. Then you go home, you don't really do anything that night. The next morning, you wash your face and you put that same complex retinol cream on, which again is gonna kind of help slough off those layers of skin. So this is about a week-long downtime as far as healing You're not really gonna expect anything the first day or so, maybe just a little redness. Day like 3 or 4, you're gonna get sheets peeling. And that sounds a little scary, but it is what we need for those results. It's gonna give you like the most profound results in the deeper scarring, the more aggressive aging benefits, acne, the pigment. That pigment you guys want to treat, that's how we have to peel it off. So that is one of the main things that we expect in that first, in the 3 to 4 days afterwards. Big things to be mindful of during that time is that we really don't want to force that peeling. We don't want to grab it and peel it off because some of those layers may not be ready to come off. So we want it to naturally kind of peel off. If you are like one of those people that like you have to touch it and you want to, we recommend just teeny scissors and just kind of cutting the skin off. Just don't obsess about it, but let it kind of naturally come off. After 5-6 days of peeling, then is when you can use like your exfoliants and start allowing it to kind of speed up that last bit of peeling that's left over. Immediately after, important things are sunscreen. While you're in a state of inflammation, we have to go through those phases in order to get to the benefits. But if you don't take care of it well, it will just worsen what we're trying to improve. So if you're not gonna wear sunscreen after or during the chemical peel, you're just gonna worsen the pigment that we're trying to get rid of, So it's one of those things where you kind of have to prep, even if you have to take time off, cancel some of the sporting events where you may be in the sun all day, plan accordingly. This is one of those things that people do during summer. Again, I'm from Florida, so we do things year round, but doing it during winter when it's not as hot and sunny out is gonna be better for minimizing the sun and the heat that can cause hyperpigmentation and kind of worsen the things we're trying to improve. It's tolerated typically really well. Again, the pre-treating is a big part that is what a lot of people get misconstrued. They come in and they want to get their chemical peel same day. So it's one of those things where I definitely recommend scheduling a consult. A consult is where we just sit, we talk about what your goals are, we talk about the things that you want treated, we offer the procedures that are recommended, and then we go about the steps appropriately. A couple things that would make us, really not want to proceed with a chemical peel, which is rare, but would be like if you had an active like cold sore or like a shingles, something like blistered on your face that we would just obviously not want to treat you, that would just worsen it. That is something that we would not want to treat. If you had really bad inflammatory acne, that can exacerbate that inflammation. Again, if you had an area on your face that was treated with radiation from skin cancer, this would not necessarily be the best option for that as well. So those are a couple of things. Beforehand, if you've ever had a history of cold sores, we usually give you a prophylactic treatment just to make sure that the peeling process does not trigger a cold sore outbreak, which can happen. So sometimes we pre-treat with that. But aside from that, they're tolerated really well. Again, we sell them in a package of 3. And it works great. On a lesser scale, that would be, again, what I would say is most aggressive. On a lesser scale, still super effective, but less intense peeling and I would say a little less downtime. It's going to be chemical peels. Not chemical peels, we just talked about that. Microneedling. Microneedling is going to be great for acne scars, again, because it can penetrate, not as deep as a chemical peel, but it can penetrate pretty deep. Fine lines, wrinkles, pigment, sometimes even rosacea. We have options with our Zeo line that is a firming serum, so that's going to be for aging. Rosatrol specifically is the serum that's going to attack and target sort of redness. And then Bright Alive is the serum that we use for pigment specifically. So those areas, those serums are what we would use during. Same concept of a package of 3, 1 a month for 3 months. Again, you can get these procedures monthly for 12 months. You can do 3 to 4 a year, completely up to you. This one has a little bit less downtime. Immediately after, we expect you to be a little bit red, maybe a little bit of pinpoint bleeding. Obviously that stops before you leave, but you look a little bit like you had something done. Then the following day or so, you really don't really appear, maybe just a slight red redness, and maybe a little gritty, but there's not like a profound peeling process like there is with the chemical peel. Another thing that we offer is PRP, which is platelet-rich plasma. So the difference of that and the ZO serums would be when you're numbing, this procedure we numb for. So we clean your face off. We take before pictures, we clean your face, we put a numbing on. And again, I like to do face, neck, and chest. Because we're using, the microneedling is like a pen. It looks kind of like a tattoo gun almost, but it has teeny little needles at the end. So we numb your face. PRP difference would be we would draw your blood, not a ton, but we draw a couple vials of blood, and then we spin that out, and it creates the substance at the top that's, again, the platelet-rich plasma. And we just use that on your face. We put it on as a serum almost, and then we microneedle on top of it and then rub the serum in. So it's allowing that substance to get down into those teeny tiny little needle holes that we created. And in that healing process, your skin starts to magnify and increase in production of, again, collagen, elastin, and hyaluronic acid with less downtime. The numbing works great. Most people feel nothing. There are occasions when you feel a little bit on the nose or forehead area, but it's still calmed down enough to where it is completely tolerable. There's not a lot of contraindications to that either, but again, would be if there was an active infection of some sort, or even really inflamed acne, if you had a lupus rash, if you had an active cancer or something that hadn't been treated yet. Sunburns. Sunburns are contraindications for both of those because the skin is so compromised and so swollen already. But again, not a lot of downtime in that area. So another, I would say it's not a procedure per se, but it is going to be in the aggressive anti-aging category, is something newer that we are offering, but it's been around a very long time. This is one of the most effective things, I think, if you're trying to get long-term benefits, is going to be Sculptra. Sculptra is a poly-L-lactic acid that is an injectable. We kind of touched on this in some of our other videos, but it is different than a filler. Again, a filler we kind of talked about is a hyaluronic acid gel for the purpose of replacing fat loss or enhancing an area that is lacking in fat. This is an injectable as well, but for the purpose of injecting a biostimulator, meaning it's going to be injected to the appropriate plane, and it is going to, over an extended period of time, anywhere between 6 to 8 months, going to increase your own production of collagen and elastin and hyaluronic acid. So this is very commonly used in this area where there's often fat loss here. It can be used in a lot of different places. It all depends on how it is placed. A filler is a gel. You get instant results when you see where it is injected. Sculptra is not going to be instant results because it is an extended period of time before your body starts to build up that collagen and elastin. So it's typically done in multiple sessions. Again, everyone is different, but most of them are going to be a vial on each side once a month for 3 months. Some people, if you're in your 70s and 80s and you've lost 70 to 80% of your fat loss, then you're possibly going to need more vials more often. So that is going to depend on the person. Your injector needs to be the one to recommend that. But that is something that people always want to sort of know, well, yes, I've lost it, but how do I get it back? And this is kind of how. It not only can help rebuild that collagen and elastin, but it can actually help with your skin complexion, your skin brightness, sometimes even redness and acne. It really does sort of transform the skin. And it's not something that like you leave and again, people are like, what did you have done? It is sort of a gradual 6 months later, people will just say, your skin looks amazing and ask what you had done. And then you say Sculptra. So we are now offering that. It is going to be great to work against. It can be used either as, it's never too late to start addressing aging. So in your 70s for the first time, or if you're trying to be proactive, getting a lesser amount in your 20s or 30s to keep up that production that is naturally going to be lost. On the other spectrum is the fillers. Again, fillers are specifically hyaluronic acid gels. There's a lot of different variations, but this, most commonly in lips, whether that's to enhance the size and the shape or just to fill in some of the fat loss that has naturally been lost with age. Sometimes it's helpful for some of the lines around the mouth. Those are a very big concern that we get as injectors. And my biggest recommendation for that is not just a filler. Filler, yes, while that can help fill in those lines, but filling and microneedling or fillers and chemical peels. So that way we're filling in the lines that have already sort of settled, but we're also really enhancing the production of the hyaluronic acid and the collagen and elastin to kind of prevent them from getting deeper. Fillers are also helpful for our areas of our fat pads. We have fat pads in our cheeks, literally everywhere, our lips, cheeks. And as we get older, they get smaller and they shrink down and then they sort of move down, which lends to that appearance as we age of things shrinking and moving in. And so the fillers can help lift and plump, which again lends to that sort of youthful appearance. It is, in my opinion, not proactive, so I don't ever recommend somebody do that alone. I recommend doing that while being proactive with the chemical peels and the microneedling and the skincare. In addition to fillers, neurotoxins are always super helpful as prevention. There is a misconception that neurotoxins make wrinkles go away, and that is something we have to spend a lot of time explaining to people. When you already have what are called static lines, meaning the lines are present whether you're moving your face or not, the neurotoxin is not going to make them disappear. So what it's going to do over time and consistency of getting your injections, it's going to soften them by limiting your muscle's ability to keep making that facial expression that's making the lines present. And over time, again, it will soften them. But if you have an 80-year-old woman who's getting a neurotoxin for the first time, it is not making her wrinkles disappear. There are other things that can do that, but neurotoxin alone is typically not the best way to approach that. Neurotoxin, again, should be used in 20s or 30s, and they should be used as preventions. That is the best way to employ one so that you continue using it in the areas that are very common to move. Most commonly, I feel, are glabella and forehead area, and sometimes even crow's feet, where we move our face 100 times a day, and those lines just start to sink in over the years. So usually I recommend, even in the 20s, something in conjunction with a neurotoxin. Skincare, I feel like, should be a no-brainer for everybody. There is nobody that is not a candidate for appropriate skincare, whether you're trying to address aging or acne or fine lines, wrinkles, pigment, whatever it may be. Even if you have rosacea and we need prescriptions, skincare should be, and sunscreen obviously should be, just a staple for everybody. If you're hesitant to kind of dive into the more aggressive stuff that we've talked about, skincare is a great intro if you're not already doing it. And again, like I said, it's never too late to start. So specifically for aging, the medical grade line that we carry is called ZO. And there's lots of different variations to it, but they have great kits that are already sort of pre-packaged and pre-made to make it easier for people that are starting. Skincare can be really sort of overwhelming for people, especially with the, social media fads and the TikToks that kind of tell you what to do. It can be hard to know what's right for you. So one, I would say, again, a cosmetic consult is always helpful to get personal advice, assessment, and guidance on how to approach that. But specifically ZO, they have an anti-aging program and an aggressive anti-aging program, and they're all going to be made up of some basic components. So cleansing, exfoliating, and toning, that's what we call getting skin ready. That is going to be a basic for everyone as a step one. What you're doing that with is going to depend on your skin type. Do you have dry skin? Do you have oily skin? Do you have acne-prone skin? We kind of help with these protocols build a personalized system for you. So they're all going to kind of start with that. Then we're going to go into correcting and treating. Daily Power Defense, which is their great hydrator and protector. It's sort of used as what I call like the shield in the morning. When you put it on, it helps protect you from the free radicals that help break down our skin and our DNA. And then we're going to go into the treating. And in this area with the anti-aging protocols, it's going to be regenerative products that increase your collagen, elastin, and hyaluronic acid. So growth factor serum, sometimes the renewal cream, and the firming serum. Again, it's one of the serums we use for microneedling. It's just a little less potent for daily application. Those are the big anti-aging products that are going to work on the fine lines that are already there. And again, you don't have to already be in your 60s, 70s, and 80s to be using anti-aging products. You can start these in your 20s and 30s as prevention, because your production is going to steady go down. But if you start them, the idea would be to prevent that aging from happening. So those systems are really, really helpful for the anti-aging approach. Again, if you have redness, there's a daily skincare program that's going to be geared towards addressing and correcting your redness. Again, the Bright Alive is great for pigment. So there's also now an acne protocol. So regardless of what your concern with your skin may be, Zeo kind of has a protocol made for you. And sometimes, again, depending on your comfort, building on top of that. So procedures in addition to skincare are always going to be optimal. And then just consistency with that. That's something big that I would say is an issue nowadays with, again, the social media influence of, thinking that you're choosing something right for your skin, starting it, expecting to see, profound visual results really quickly, and then when you don't see it, starting and stopping, getting something else, starting and stopping. Just in general, it takes about 2 to 3 months for your skin to really start having a compounding effect of skincare, and it's hard to see the results sometimes. So, not stopping and being consistent with your skincare is a big tip that I would say maybe the difference of you over time having results and not having results. So stick with your skincare plan and do it with a provider who is knowledgeable in the products and skin types. So that would be, big advice.